Hello, my name is Rebecca Brenner and I am a patient navigator. I am going to be proposing to the Geisinger healthcare system as to why they need to have better access to tobacco and alcohol dependent and addiction resources. I will be proposing a system that better advocates less stressful and more encouraging physical activities to better help these patients cope with their addictions and dependencies. According to the Center for Health Affairs, patient navigators are healthcare extenders that guide patients through and around barriers in the complex healthcare system. These healthcare professionals guide patients through the healthcare system, helping them to overcome obstacles faced in accessing or receiving treatment. For example, if a patient is receiving cancer treatments, I would be paired up to them personally and work closely with their oncologist, which is a specialist MD, to make sure that they are receiving the most adequate and appropriate care in line with what they require, and maybe even help them through the financial hardships that come along with the treatment of cancer. Patient navigators also sometimes help patients with transportation issues in order to better get them care for the treatments that they require. Tobacco and alcohol dependence are strong issues that not only impede the lives of those that the addiction directly affects, but it also spills over into the lives of those closest to those addicted, including family, friends, children, and spouses. These addictions are issues that need drastic lifestyle changes in order for a patient to become healthier, both in body and in mind. There are many causes that could be the reason that a person turns to alcohol and tobacco dependence and/or addiction. Maybe there were issues in the household of the person growing up and they learned from examples, such as from a parent or a guardian. Maybe there was peer pressure in school to fit in or look cool, and they didn't want to feel left out. Maybe it was just a stress reliever that quickly developed into a necessary evil. Tobacco and alcohol dependence is an intense and frequent problem in an addicted person's life. The onset of these dependencies can begin as early as adolescence if a person is exposed to it early enough at home, such as in farming communities, the issue of chewing tobacco as a way of dealing with smokeless tobacco inhalation. It becomes more of a issue of trying to look cool and fit in because it's a societal norm, as opposed to something that people do to be a stress reliever, such as tobacco. And people are mistaken in thinking that choosing smokeless tobacco issues such as chewing or this new vaping trend, that they're doing less harm to their bodies, which is not the case, because there's still the issue of cancers being able to be a cause of these choices of addictions and dependence being made. But now, instead of lung cancer, it's gum cancer, tooth decay, enamel rotting, all kinds of different things that are issues now because you chose to be more concerned with fitting in than choosing what is healthy for your own body. Alcoholism and tobacco dependence can last an entire lifetime if the affected person has no desire or drive to end the addiction. If there's no desire to make a change, change will not occur and change will not stick. One thing that I would be able to suggest for an alcohol or tobacco dependent person to be able to more easily quit the habit would be to replace it with something that is easily accessible, such as a new hobby. Knitting and crocheting, running, DIY projects for the house, cooking, crossword puzzles, and learning a new instrument are all just a few suggestions that can be very time and attention consuming and therefore make it easy for a person to distract themselves with these activities. As a patient navigator, I would also help to guide an alcoholic patient of mine through the steps to check themselves into rehab if it was necessary for them to receive the treatment and one-on-one counseling that they need. I would guide them through the process of submitting an insurance claim to help defray the cost of treatment at a rehab facility if they were not familiar with the technical terms or proper forms that they would need to fill these out. I would also help my patients keep current on group and individual support meetings that they should attend in order to meet others going through similar issues so that feelings of anguish and helplessness can be discussed and dealt with in a calm and easy way. Tobacco and alcohol dependence is a lifelong battle, especially if it started at an early age. But with enough intervention and help from caring individuals such as patient navigators, in addition to medical interference by doctors and nurses, we can better help the patients overcome their addictions and dependence and live a better, healthier, more productive, and fulfilling life. Thank you. Now for the self-assessment. I believe that I accurately represented myself professionally in the role of a patient navigator. I think I successfully made the case that changes is needed for these issues and is possible. I sufficiently explained the cause of problems and gave examples as to how it can occur and begin in the first place. I discussed the frequency, intensity, duration, and onset impact of the problem. My solution was very practical, I feel, because they're everyday things that most people don't think of that can be helped and can be used as distractions in order to get rid of healthy, disgusting habits. And I think I did best in my suggestions of things to replace alcohol and tobacco dependence with. What I can do better in the future for this would be to better remember what I'm supposed to say as opposed to referring to notes consistently, because that's always a problem. Thank you for your time. Bye.